Good afternoon. Thank you for watching our live update for Thursday, February 11th. Today, I have our COVID-19 update and a couple other things I'll share. Then Debra Jacobsen has information about our upcoming independent living vaccination clinic scheduled for February 24th and 25th. After Debra, Glendon Kemp from security has some comments about our preparations for the winter weather that could be coming in later tonight, tomorrow, and over the weekend. And then lastly, Pastoral Care has a segment for you. So in terms of our COVID-19 update, yesterday or today, I'm not sure which, we learned that an independent living resident in the tower has tested positive for COVID-19 after showing some mild symptoms. The resident and spouse are quarantined in their apartment, and after contact tracing, we believe that the risk of exposure to other residents is very low. We don't exactly know what the source is, and we'll continue to work through that as best we can, but on a number of occasions we've not really been able to determine what the source of it was. But in this case, this resident did not have much interaction with others, so we're thankful for that, and we're also very, very thankful that the symptoms are mild. We also learned that a dining employee from the kitchen has tested positive for COVID-19. And so currently we have 3 employees who have tested positive and are out from work in quarantine at home. This most recent dining employee works in the main kitchen, and subsequently a small number of very important culinary positions in the kitchen have been exposed and will need to quarantine for 14 days. So subsequently, due to these staff members being out in quarantine, the dining department has had to make the difficult decision to suspend the Canterbury takeout option for the residents until these quarantine staff members can return back to work. Scott and the culinary team need to consolidate their staffing to cover for these positions that have to quarantine. And so for a couple of weeks here, we're not going to be able to do the Canterbury takeout. I think that starts, well, I know, it starts today. We won't be doing it tonight, and we won't do it for a period of about 14 days. I don't know the exact end to that, but on early next week, Tuesday's live briefing, we'll try to have a definitive date for you when we'll restart that. Now, let me change subjects a little bit to the vaccination process. Our final assisted living vaccination clinic for residents and employees to receive their second dose is Monday, February 15th, so this coming Monday. So any of our assisted living residents will get their second dose, and staff who got their first dose as part of that assisted living clinic will get it on Monday. Now this will only be a one-day clinic, so now I'm speaking to the employees. You will need to come in and get your vaccination, your second dose, on the 15th. For those of you who got it, it was a 2-day clinic the first time. Now it's a 1-day clinic. So you need to come in on Monday because we will not have any vaccinations on Tuesday, the 16th. Some of you may have seen this, but yesterday afternoon, the Centers for Disease Control and Prevention, the CDC, released some new guidance to us and to the public related to what fully vaccinated people will be required to do if they find themselves exposed to someone who has tested positive for COVID-19. As you know, from the beginning, Westminster Canterbury has followed all the guidance that we've gotten from the Centers for Medicare and Medicaid Services and the CDC and the Virginia Department of Health. And that's been helpful, but they're not always in alignment with each other. As we manage the next steps in terms of how we deal with positive results for those that have been vaccinated, because some of us will probably continue to get the virus even after we've been vaccinated, and how we'll handle exposures for those of us that have been vaccinated, we're starting to get a little clarity on that. Being fully vaccinated means that you've had both doses, your first dose and your second dose, and that you're 2 weeks beyond the second dose. That's when you are fully protected, and your immunity to the virus should be at the peak. At this time, everyone, including vaccinated persons, should continue to follow all the current guidance to protect yourselves and those around you, including wearing your mask, keeping your social distance of 6 feet, avoiding crowds, and avoiding poorly ventilated spaces. Wash your hands. Cover your cough if you have one. Follow the CDC travel guidance. Follow all the applicable workplace guidances for staff. The new guidance says that vaccinated persons, so those of us that have had the shot and 2 weeks beyond, and we get exposed to someone who's suspected or confirmed, we're not required to quarantine if we can meet all of these criteria. So there's 3 criteria that we have to meet in order to not have to quarantine. The first is that we're fully vaccinated, both doses plus 2 weeks. We're within 3 months of receiving our last dose, so they're only going to let us not be quarantined for those 3 months, and we are asymptomatic in terms of having any COVID-19 symptoms. And so that's the way we're going to interpret it. That's what the guidelines say. Now, that guidance is different if you live in Parsons Health Center. So the guidance, and I think work in Parsons Health Center too. So that's for people in independent living and assisted living. But if you live in the healthcare center, there's a different set of rules. And we'll work with those rules that we get from Virginia Department of Health and CMS. Now, we know you're hearing about these new guidance from the news. We've seen it on the news as well. So we just want to share it with you as we get it and we interpret it in terms of what it means to us. If you have any symptoms or you find that you've been exposed to anyone who has tested positive for the virus, please reach out to your physician, reach out to the clinic so that we can then consult with you with Virginia Department of Health to determine the best plan for you and for us and the next steps, because every situation is a little bit different. And Virginia Department of Health and the epidemiologists that we work for, they will step in and tell us exactly what the process is going to be based on the situation, like with our newest case. So let us know as soon as you think you might have been exposed, and we'll help you through the process. The guidance is changing all the time, and we expect it will continue to change a lot over the next period of weeks. We're going to learn a lot more about the virus and the vaccine, and we'll continue to share what we learn in our updates and do our best to help you navigate this. So last thing I want to talk about is our next steps. We want you to know that as we get this community fully vaccinated, and as I shared on Tuesday, 98% of the residents on this community have been vaccinated or will get their second dose in the coming weeks. That's really a big step for us as we begin to think about how do we get this campus restarted and reopened. Now, we know we have to continue to work our way towards fewer and fewer cases. We're still seeing staff test positive. As I said earlier, we had a resident test positive today. So we're not out of the woods. We're going to continue to see it. But we're working behind the scenes. A large group of us are working on plans and criteria that will help us restart our internal programs and begin to set the criteria for when we can restart visitation and those other sort of more opening up of the campus. We're eager. We're eager, and we want to get there, but we got to do it safely. So we'll continue to approach our next steps with an abundance of caution, but we'll definitely move in that direction as we're allowed and as the conditions allow. So thank you very much for your partnership in moving this community forward in a safe way. We want to make sure we keep everybody well and healthy and keep each other safe. And so we're going to keep pushing to get our staff vaccinated, and we're going to keep pushing to keep residents safe as much as we can. And so that's it for me today. I'll see you on Tuesday. Next up is Debra Jacobsen with some information about our independent living vaccination clinics scheduled for 2 weeks. See you on Tuesday.
Good afternoon. I'm here today to talk to you about the clinics that will be February 24th and 25th for the independent living residents. We're making the preparations now for that second dose of independent living vaccinations. Prior to our first set of vaccination clinics, the independent livings were asked to fill out consent forms from CVS. This process needs to be repeated again for the second vaccination clinic. There's a detailed memo in your box waiting for you as soon as you finish watching this live stream. It will explain to you the process. If a form is placed in your box and you received the vaccination at a different location, just place it back at the front desk or the center desk and we'll take care of that. We tried to pull them all out, but in case we made a mistake, just put it there. We do occasionally need a second set of forms for our couples, so that will be very helpful to us. Once you complete the form, if you'll return it to the locked boxes that are located at the center and the tower desk, we're asking you to return those by noon on Tuesday, February 16th. So you have a little bit of time to gather that information. The good news is we do have copies of the forms that you completed for the first vaccination clinic, and we plan to review the second round of consent forms after they're returned to us. If you need any assistance filling out the consent forms, we will open the helpline again today, Thursday, February the 11th. Please call extension 1570, that's 1570, to leave a message. A staff member will call you back as soon as possible. We will provide a schedule for your floor closer to the second vaccination dates on February the 24th and February the 25th. The process will remain the same, starting right here in the Sarah Bell November Theater at your scheduled vaccination time. You will receive your paperwork when you come in the door, and you will stay in the theater until your name is called. We hope we will be as successful with this process the second time as it was the first time, and we thank you for your cooperation. So thank you in advance for your patience and your support as we finally get that second vaccination in our arms. Up next is Glendon Kemp, and he's going to talk a little bit about the weather.
Good afternoon, everyone. It's all about safety today. I'm going to talk about snowstorm preparations. We are taking every precaution necessary, and all safety measures are in place for the forecasted snow and ice. Our facilities and grounds teams will be working around the clock to ensure that all operations are running properly. More on that in a moment. We are prepared to handle significant snow over the weekend should this occur. The snow, as you may already be aware, may impact some of our support functions, such as transportation, which may be shut down if conditions are unsuitable for transporting residents. Food delivery may be delayed slightly to independent living residents if staffing levels are affected by bad weather. Essential personnel are being housed on campus to ensure that all of your needs are met. For your safety, you should know that the engineering team will actively be working on clearing operations both during the day and nighttime hours. It is important to allow the snowplow drivers and snow clearing equipment adequate space to perform their job safely. Avoid going outside during the overnight hours to allow the engineering team to clear work zones free of pedestrian traffic. In the early dawn hours, avoid walking in main drive lanes and parking lots. It is best to stick to sidewalks and always be visible to oncoming traffic. Keep in mind that it takes longer times to slow down snowplow trucks and other snow clearing equipment, so it's best to try to avoid walking in the roadways or parking lots to prevent any accidents. Try to walk only on sidewalks that have already been cleared and avoid walking on uncleared sidewalks. Also, if you approach an area that has caution tape or cones blocking off entrance or sidewalks, turn around and do not cross these lines, as they have been deemed unsafe and will remain closed until it can be cleared and is safe to use. And, as with any anticipated weather event, you should refer to your resident handbook for further emergency planning. Thank you for doing your part with this effort, as there is the possibility of multiple snow events should the recent forecast remain consistent. And up next is Vanessa Perry. Thank you.
Good afternoon. A sermon for every Sunday will air on TV 970 this Sunday, starting 4 p.m. The Transformation Sunday message will be offered by Reverend Carla Pratt Keys, who's the pastor of Ginner Park Presbyterian Church. Sign-ups are still being taken for the Lenten Spiritual Practices study group led by Bob Hetherington. The sessions will reflect on the weekly gospel text in a repetitive, reflective way. Sessions will begin on Wednesday, February the 17th, lasting 7 weeks. Please call me at extension 1502 to sign up, and participants will need to have access to a computer or laptop, as this will be a virtual session. A reading from Philippians 3:13 through 14. Brothers, I do not consider that I have made it my own. But one thing I do, forgetting what lies behind and straining forward to what lies ahead, I press on towards the goal for the prize of the upward call of God in Christ Jesus. Don't Quit by Edgar A. Guest. When things go wrong, as they sometimes will, when the road you're trudging seems all uphill, when the funds are low but the debts are high, and you want to smile but you have to sigh, when care is pressing you down a bit, rest if you must, but don't you quit. Life is queer with its twists and turns, as every one of us sometimes learns, and many failures turn about when we might have won had we stuck it out. Don't give up though the pace seems slow. You may succeed with another blow. Often the struggler has given up when he might have captured the victor's cup, and he learned too late when the night came down how close he was to the golden crown. Success is failure turned inside out, and you can never tell how close you are. It may be near when it seems so far. So stick to the fight when you're hardest hit. It's when things seem worse that you must not quit. Please join us next Tuesday for our next 3 p.m. update.